Let's see, General Newman or General Watson, we got anything I can help you with before I bring the jury back in?
I don't think so, Judge.
Okay.
Judge, we are going to be introducing pictures of, next will be Dr. McMaster. I think family may have already been told.
Okay, so our family members, I think her sister's still in here. They're going to show some bad pictures. And I don't know if you want to be in here. If it was my sister, I don't have one. It's my brother. I wouldn't want to be in here to see these pictures. But it's up to you. I'm not telling you to leave. Your call. Okay? All right, everybody rise, please, if you'll bring our jury in. Thank you. Have a seat, please. Record can reflect that all our jurors have returned from dinner. Thank y'all for coming back. I guess you'll have a whole lot of choice about coming back, but I'm glad you're here anyway. All right. Let's see, who'll be our next witness?
Dr. McMaster, Your Honor.
All right. Ma'am, if you'll step up here next to me, please. If you'll raise your right hand. Swear to tell the truth, the whole truth, and nothing but the truth, so help you God.
Yes.
Thank you. If you have a seat, please. If you'll speak up into that smaller black microphone there in front of you, that'll help me hear a little bit. And then also, if you'll tell me your first name and last name and spell them both.
Yes, Your Honor. My first name is Amy, A-M-Y. My last name is McMaster, M-C-M-A-S-T-E-R.
Thank you. Questions?
And Dr. McMaster, what position do you hold currently?
I currently hold the official position of Chief Medical Examiner for Davidson County.
And can you tell us what a medical examiner does?
Sure. A medical examiner is a doctor who is specially trained to investigate how and why people die. So we are doctors who are specially trained to interpret injuries and natural disease in order to determine the cause of death.
And can you tell me what training, education, and experience that you possess that enables you to do your job?
Sure. I received an undergraduate degree in chemistry here in Murfreesboro at Middle Tennessee State University many years ago. After graduating from MTSU, then I went to medical school at Meharry Medical College in Nashville, where I received my medical degree. After graduating from Meharry, then I did 5 years of training in anatomic pathology and clinical pathology. Those 5 years are called a residency, and that was done at the Vanderbilt University Medical Center in Nashville. After finishing residency, then I did an additional year of training in forensic pathology. That year is called a fellowship year, and that was done at the Dade County Medical Examiner's Office in Miami, Florida. After finishing fellowship, then I came back here to Nashville, where I've been employed since 2002.
Okay. And can you tell me over the course of your career approximately how many autopsies you performed?
I don't keep an exact count, but it's probably at least a couple of thousand.
And what is an autopsy?
An autopsy I like to describe as an extensive surgical procedure, and the goal of an autopsy, at least a forensic autopsy, is in order to determine how and why someone has died.
What does the term forensic mean?
Forensic means of or pertaining to the law.
Okay. Now, there are terms that you, well, let me finish with, along the line of question I was pursuing just a second ago. Have you ever testified as an expert in the field of anatomical, clinical, or forensic pathology before?
Yes.
And can you tell us in approximately how many counties in the state of Tennessee have you testified as an expert?
Again, I don't keep a list. I would semi-quantify it as many counties. The office in which I work in Davidson County covers the vast majority of Middle Tennessee and some of West Tennessee. So I've testified in many counties throughout Tennessee.
Have you ever testified in this county, Rutherford County, as an expert?
Yes, sir.
Have you, and approximately how many occasions do you think you have?
Again, I don't keep a list, but probably here in Rutherford County, it's been less than 10 times, I believe.
Okay. Have you ever testified in this court in front of this judge before as an expert?
Yes.
Your Honor, at this time, we will offer her as an expert in the areas of anatomical, clinical, and forensic pathology.
Any objection? Yes, sir. I'll give her opinion.
Dr. McMaster, did you perform an autopsy on a Cantina steward?
Yes.
And you prepared a report, is that correct?
Yes.
And I think you actually prepared 2 reports as well.
I did. I prepared the initial report and then an addendum autopsy report.
Okay. I'll show you, I guess, first what appears to be the initial autopsy report. I don't know if you can see it well or not. Can you identify that as being your autopsy report?
Yes, sir, I can.
Okay. Now, I assume you have a copy of your autopsy report with you on the stand. Is that correct?
Yes, sir.
I'm going to ask you some questions from it, and feel free to refer to your report. We're going to make an exhibit of it after your testimony. But as far as it says here on this, date and time of death, what does that mean?
Date and time of death is the date and time, obviously, in which someone is pronounced dead. It doesn't necessarily mean it's the exact date and time in which they took their last breath. Sometimes it does, sometimes it doesn't. Sometimes people are found dead. In Tennessee, the law is such that you are, when you're found dead is when you're pronounced.
Okay. And so an example of this case, if she was found at the apartment and if she had no signs of life, but she wasn't pronounced dead until she got to the hospital as much as 30 or 40 minutes later, the time would be the time that the hospital personnel pronounced her dead.
Yes, sir.
Okay. Even though she may have been dead for half an hour, whatever.
Yes, sir. Again, the way the law is here in Tennessee, you're not dead until you're pronounced dead.
Okay. Now, as far as the autopsy itself, can you tell us what an autopsy is?
As I've previously started to describe in my testimony, an autopsy is like an extensive surgical procedure. And we start out examining the outside of the body where any injury or natural disease that's noted on the outside is documented. And it's documented both with photography, usually diagrams also, and finally in the autopsy report. After the external portion of the body is examined, then we turn our attention to the inside of the body. It's called the internal examination. And that is where all of the internal organs are removed. Most of them are weighed and examined. And again, we document any natural disease or injuries that we find inside the body as well.
And was that done, in this case, on Ms. Stewart?
Yes.
Okay. Now, what age were you told Ms. Stewart was at the time of the autopsy?
Her age was reported to us as 21 years.
And can you tell me what procedure you go through to weigh and measure a body that's brought in?
Sure. I don't do that procedure myself. Many of the procedures are done under my direction through standard protocol throughout the office. We have assistants that help us with that. But that is done by each body that comes in for examination is weighed, and that's done by a scale that's in the floor. And the bodies are placed on gurneys, and it's rolled onto the scale and weighed. Obviously, we subtract the weight for the gurney. And then the measurement is a little bit more difficult. We use a long wooden measuring stick, and because sometimes just of the nature after death, decedents aren't always laid out flat or necessarily straight, but we get a good estimate of what their height would be prior to their death.
And your estimate in this particular case was what?
63 inches.
Would that be 5 foot 3 inches in terms that I would understand, right?
It would.
Okay. And as you said, it could be an inch or two off at the most, I would think. Is that right?
That's correct. It's common in my experience for there to be some discrepancy in the height or the length that we've described at autopsy to what has been reported, again, prior to death.
Are there any terms that you think it'd be helpful for you to define before you start telling us about your findings so the jury will understand your testimony, such as what a stab wound is or an incised wound, a laceration, an abrasion, things of that nature?
Yes, sir. As a forensic pathologist, when I'm describing injuries, I typically will classify them based on what caused the injury. For example, when you're dealing with a weapon or some type of something that has a sharp edge on it. There are different types of injuries that can be caused by that sharp edge. You can get what's called an incised wound, which probably most of the lay population would call a cut. But again, it's something that's from like a knife or a sharp piece of glass that has a cutting edge on it. So an incised wound is generally longer than it is deep. You can also get a stab wound, obviously, and a stab wound is typically deeper than it is long. Those are, general terms. It doesn't always hold true, especially with superficial wounds. It may not be possible to classify them that way. But again, incised wounds, stab wound, both from cutting edges. The other types of blunt trauma, or if something scrapes against the skin, is another type. An abrasion is where something is dragged or your skin hits something, a blunt object or a hard object, something that doesn't have an edge on it. That would be an abrasion if it's superficial. If the skin is actually torn, that's called a laceration. So those are just some general terms that we use in forensic pathology to describe what caused a particular type of injury.
Okay. Any other terms you think would be helpful to the jury, or is that pretty much got it?
I think probably at this point it would. Certainly if any other terms come up, I'll be happy to explain them to the jury.
Can you tell us, when you did the external examination, what did you find?
What I found was Ms. Stewart had several injuries from what I would call a sharp instrument or something with a cutting edge on it, such as a knife, for example. She had a stab wound of her chest. The stab wound entered on the right side of the chest, and after it entered the chest, it injured the aorta, which is the major blood vessel that leaves the heart and feeds the rest of the body. And it also injured the right upper lung lobe. So the upper portion of the right lung was also injured. That wound path was downward and front to back. There was also a superficial stab wound of the back of the left shoulder, and associated with that superficial stab wound were linear abrasions that I previously described, and there was a pattern to them, meaning there was a regular pattern or a regular appearance to it. And she also had a small superficial linear pattern abrasion of her, the back of her left upper arm. There was also an additional very superficial stab wound of the back of her left neck area right up here under the hairline. Again, very superficial and very small.
And when you say superficial, I guess it's kind of in the eye of the beholder?
Well, yes, the ones other than the one of the chest, when I say superficial, meaning they didn't penetrate into any body cavity or deep into the body itself. So yes, superficial in this term is relative.
Okay. Now, let's take stab wound number 1, which is the stab wound to the chest. Did you take photographs of that stab wound?
Either I took the photograph or it was done at my direction, yes.
Okay. And you recognize the photograph?
I do.
And does it show the general location of where that stab wound was?
It does.
Okay. And some people may think that looked more like a gunshot wound. Can you tell me what happens that causes a stab wound to sometimes get round looking?
Yes. Again, this has a somewhat rounded appearance to it, as opposed to some stab wounds have a more pointed end to it or a more narrow appearance. But there are lines of tension in the skin. The technical term is called Langer's lines, and those lines of tension is what gives our skin form. Plastic surgeons will take advantage of Langer's lines when they're making incisions on the face because it will affect which way the skin will gape or pull open. And in this case, the cut is across one of those lines, which causes it to gape open. So again, another way of describing it is the knife in this case has cut those lines of tension in the skin and allowed it to gape or pull open, giving it a more rounded appearance.
And I'll show you another photograph of that same area. Can you tell us what we're looking at there?
Yes, this is the same stab wound that has been reapproximated, which means an assistant is pushing the ends of the stab wound together to give it a closer appearance to what it would have looked like prior to it gaping open.
Now, as far as that particular stab wound, Can you tell me what injuries that stab wound caused?
Yes, that stab wound penetrated in between the ribs. It cut the right upper lung lobe, so the upper portion of the right lung, and aorta, which is the major blood vessel that leaves the heart.
Now, with cutting the aorta, what would happen?
Well, if medical attention is not obtained in a timely fashion, then death will ensue.
And is that what you call bleeding to death?
That would be, yes, one way of describing
Layman's
it.
terms?
Mm-hmm, yes.
Now, as far as the piercing of the lung, what would that cause as far as any medical situation?
Anytime the chest cavity itself or the lung is pierced, there are two things that can happen. The lung has a lot of blood supply to it. So one, an effect of the lung being cut is bleeding, but the other effect of the chest wall being pierced or punctured allows air into the chest wall. And our lungs expand on what's called a bellows type. So there's no air in the chest itself. And when you lift up your rib cage, it allows your lungs to expand. And when you compress down, it pushes the air out. Well, when you've got air in the chest, your lungs can't expand properly like they should. So two things would happen. You would bleed, and you would have air in the chest, making it very difficult to expand your lungs and breathe.
After suffering this particular type of injury, can you describe how the body would react? What would happen?
Well, the bleeding, of course, there's nothing about the wound that would cause someone to be immediately incapacitated. It would be painful, it would hurt, but there's nothing that would be able to stop someone from having some type of physical reaction to it. So someone would become short of breath fairly rapidly from the puncture of the lung and the cut of the lung, and also they would bleed. And depending on how rapidly the bleeding would occur, they would begin to feel very weak. Shock would ensue, and again, if medical intervention doesn't come in a timely manner, someone would bleed to death, and then they would die.
Now, were you able to measure an approximate depth of that particular stab wound?
Yes.
And what were you able to determine?
The maximal wound depth of the stab wound to the chest was about 2 inches.
Okay. Now, as far as taking a serrated blade, steak knife, kitchen knife, something like that as your instrument that you use, and how hard or easy would it be to cause that particular stab wound?
Well, you know, again, hard and easy are relative terms. The skin, human skin, is fairly dense. It's fairly tough tissue. The tissue in between the ribs is also relatively tough. So it's not quite as easy to pierce human skin as some people would believe. So, you know, it would take a moderate force, certainly not a trivial force, to cause this.
Now, as far as the downward direction of it, I understand it's slightly downward, but that would be, the wound would be front to back and would be downward.
Yes, sir, slightly downward, which just simply means that when the knife tip, when it ended up in the body, it was lower than when it began in the body.
Okay. If you were going to try to recreate that wound, let me ask you a hypothetical question. Would a reasonable way to recreate that wound with a serrated blade kitchen knife is to take the knife in your hand and stab down?
That's possible. That's not the only way it could be done, but that's certainly one possibility.
Okay. Is there any more situation any other situation you could think of that would be more probable?
Well, I don't know about more probable. Another way that could occur, of course, not to the exclusion of all other possibilities, but if you were to stand behind someone and stab from behind forward, that's certainly a possibility. You know, again, there are more possibilities than that, but those are probably the two most probable.
Okay. As far as somebody walking into a knife, how probable would that be?
Well, just walking into it wouldn't do it. There would have to be more force than that in order to pierce the skin and extend 2 inches through the chest wall into the body.
Anything else that you think is important for the jury to know about wound number 1 to the chest?
Well, associated with that stab wound to the chest, there was 875 milliliters of blood, which is milliliters is just the metric measurement that we use to measure the volume of blood that was in the chest, and a little bit of blood was found in the sac surrounding the heart.
Can we move now to the wound on the shoulder?
Yes, sir.
And
You want to make those two pictures and exhibit now?
I can, Judge, if you want.
Is that 14?
Yes, sir.
15, okay, 15A and B, please.
Can you tell us about stab wound number 2, I believe, which is the one to the shoulder?
Yes, sir. On the back of the left shoulder is a superficial stab wound. It's about a 1/4 inch by 1/8 inch, so it was, again, relatively small. And beside the stab wound are some linear patterned parallel abrasions, meaning something rubbed hard against the skin, and it has little linear parallel lines associated with it.
Okay. And you recognize that photograph?
I do.
And should it be in that position there? Or what's the best position for you to show the jury? This will be her head, is that correct, her hair?
Yes, sir, that's
And
correct.
Shoulder,
Mm-hmm.
the wound. And let me show you another picture, may show it a little better. Which way?
I believe that orientation would probably be best.
That one.
No, sir, the other way.
Sorry.
That's okay. Yes, sir, I think that would be best.
And that you can see what you call the linear abrasions.
Yes, sir. In this group of injuries is the stab wound. Is there a pointer or some other type of instrument which I can...
I've-
Face the screen if you'd like to.
And it may be easier, General, if we could back out for a smaller magnification.
Just tell me when.
Yes, sir, right there. So the stab wound, this is dark on my screen, but the stab wound is here at the top end in the circle. And these here are the linear parallel patterned abrasions that I previously testified to. And when you see these in association with a sharp instrument such as a knife, it generally indicates that a serrated knife was used.
And you just touch the corner of the screen with that stylus and that'll clear it off. Or Ms. Kimbrough, hey, you did great.
I guess. And the one you showed before, you said had a little, but does that show the, what you call the superficial stab wound?
Yes, sir,
Okay, be it superficial or not superficial, it is a stab wound?
it is.
So you're gonna make that the next number to do?
Please, Your Honor.
Okay. 16A and B.
I may throw you off. I'd like to go to the one that's mentioned in your report, which I've listed as probably wound number 4, but it was to the back of the head. Can I refer you to that area? It may be in your addendum, I think.
Yes, sir, that's listed in the addendum report.
Okay. Can you tell us about that particular wound?
I can. It's in the hairline of the back left side of the neck. And again, it's a relatively superficial wound. It only goes down into the subcutaneous tissue or the tissue just beneath the skin. The wound depth is less than an 1/8 of an inch.
And can you point out by using your screen where that wound is? And you've got your ruler there as well, right?
Yes, sir.
To indicate that. Okay, if you could clear that. And then to get a better photograph of the wound, did y'all have an opportunity to remove the hair?
Yes,
in that
sir.
area? And then also, I think, like you said, push it together?
Yes, sir. Again, the wound is here. Some of the hair has been shaved away and the wound has been reapproximated. The wound edges have been pushed back together.
Okay. And so that is another stab wound?
Yes, sir.
Now, I'm going to show you well, let's talk about the one I think you got listed as number 3 on your first report. That would be the linear abrasion, I believe.
Yes, sir.
What can you tell us about it?
I can tell you that...
Judge, I'm sorry, should I make these exhibits before we start?
Right. That'll be the next number, exhibit 3, A and B.
I'm sorry, Dr. McMaster, if you can continue.
I've described it as a superficial abrasion of the back of the left upper arm. It's about a ½ inch long. It has very faint, some of those similar parallel lateral abrasions next to it.
Okay. Do you have any idea what could have caused that?
It's so superficial, it's more difficult to classify the wound. It could be from a sharp instrument and it just barely grazed the skin. It could be from something else, but it's so superficial, it's more difficult to classify.
Okay. As far as what could have caused it, could this be a carpet burn?
It's not what I would consider a carpet burn. It's too narrow and defined for that. But no, I would not consider it consistent with a carpet burn.
So based on that, you believe the arm came into contact with some firm or hard or sharp object that caused this injury?
Yes, sir.
I think and is that the injury that we're talking about?
Yes, sir.
And on what arm was that?
The back of the left arm.
Now, we'd like to make that an exhibit.
Okay. Do the next number, exhibit.
Dr. McMaster, you also did the internal examination, and you've told us basically what that is. Anything significant on the internal examination?
Other than the injuries that I previously described, no.
Oh, I'm sorry. The chest obviously had internal problems, the aorta and the lungs, right?
Yes, sir.
Okay. As far as any other organs, were there any problems?
No, no, sir.
Okay. Now, also as part of the autopsy, are there drug tests performed or blood sent to the lab for the purposes of seeing if there are any drugs or narcotics in the system?
Yes.
And was that done in this particular case?
Yes.
And can you tell me what the results were?
The results of the toxicology testing were negative.
So there were no drugs detected in their system, is that correct?
That's correct.
I want to show you, and this is one I believe is electronically signed, but it appears to be your autopsy report issued, let's see the date. This was the initial autopsy report, is that correct?
That's correct.
And it contains several pages and describes those injuries and the wounds, is that right?
Yes, sir.
Anything in that autopsy report that we haven't covered that you think is important for the jury to know?
No, sir.
And then your addendum autopsy report, do you recognize that document?
I do.
And is there anything in that that you think is important that the jury should know?
Not that I haven't previously testified to.
I do have one question concerning it. The 1 to 7 o'clock position, what is that? I noticed that's in your report, and I think it's on 2 injuries. What does that basically mean so the jury can understand what you're saying when you say the wound is in the 1 to 7 o'clock position?
When you're describing a stab wound, usually, not every time, but usually we'll describe its position in relation to the face of a clock. For example, if one end is at 1 o'clock and one's at 7, we will describe it in the 1 o'clock to 7 o'clock position, or 12 to 6, or 3 to 9. It just gives a relative position as to how it's oriented on the body.
Doctor, did you do a diagram showing the wounds on the body?
I did.
And I don't believe I have a copy with me. Could you furnish us a copy, or can we have a copy made, or do you have it with you now?
I do.
Judge, could we have a...
We'll take that and go make a copy of it, bring it right back in here. So committed.
Yes, sir, and I'll ask her a few more questions.
For the original back.
Now, Doctor, all the answers to all the questions that you've been posed, did you give those to a reasonable degree of medical certainty?
I did, except for the other indications where I've indicated something is possible.
Okay. Now, let me ask you this hypothetically. Is it consistent with your findings that all of these injuries could have been caused by a single weapon, to wit, a serrated blade kitchen knife?
Yes, these injuries could be caused by a single-edged serrated kitchen knife, but not to the exclusion of all other possibilities. But yes, those would explain these injuries. I'm going to zoom out. I don't know if I can get out far enough, but we'll start with, which it looks like there's a, let's start with this. Can you tell us what's significant there? And feel free to point on the screen and indicate to the jury what you're talking about as far as locations of wounds and things of that nature. This is a summary of the wounds that I previously described. The wound of the chest that I've just circled on top of, the wounds on the back of the left shoulder, the superficial wound to the back of the left arm. The only one that's not on the diagram, which is the reason why there's an addendum report, is the one on the back left hairline, which would be approximately there.
Okay. And is there anything different about this particular diagram that you'd want to point out?
I think it's two copies of the same diagram, I believe.
I think so. Yeah, we'd like to make that exhibit as well.
Okay. What number would that be? 19. Thank you.
And would you make a copy of your autopsy reports and the addendum, an exhibit as well as that?
Yes, sir.
We'd like to make those.
That'd be 20.
There's two. You want to make them?
Okay, we'll do 20 exhibits.
God, I believe those will be my questions.
All right, thank you. Question, Mr. Brandon? Yes, sir.
Good afternoon, Dr. McMaster.
Good evening. How are you?
Good. Now, you've testified there were two different autopsy reports in this case. Is that right?
I testified there was an original autopsy report and an addendum indicating the additional stab wound.
Okay. And the original report was signed by yourself electronically on April the 28th, 2011. Is that right?
It is.
Okay. And would that have been when you prepared your report?
Well, that's when I would have officially signed it. The preparation begins at some point prior to that.
Okay. That's when you completed your report. Would that be a fair way to say it?
Yes.
Okay. And then the addendum report resulted from a call from the district attorney's office, correct?
I received a call from someone, I can't remember if it was a member of the police department or someone with the district attorney's office, yes.
This year?
No, I signed the addendum on July 18th, 2011.
Okay. At the bottom of the addendum, it shows certified copy on March 19th of 12. That wouldn't have been when that was prepared?
No, that just means that whoever prepared the report sent it out and certified it at that date. But I electronically signed it on July 18th, 2011.
Right. But your testimony is that the district attorney's office didn't call your office back in March of this year and say, hey, we noticed that one of the wounds is left off and we need to get this corrected.
It was prior to March of this year that occurred, yes.
Okay. But you're saying it was in July of last year?
I'm saying that sometime prior to when I signed the addendum report in July of last year, yes, I became aware that I had omitted the small stab wound from the scalp from the original report.
Okay. But and it's just a mistake which we all make, right?
Well, I don't know that everyone makes it, but I made it in this particular case, yes.
Okay. And you didn't intentionally leave that out?
No, sir, I did not.
Okay. And you performed the autopsy yourself, Dr. McMaster?
I did.
And I think you just said this, but the only distinction between the original report and the addendum report is the addition of one wound, correct?
That's correct. All of the other findings of the original report remain unchanged.
And that was at the base of the skull?
Not the base of the skull, the scalp.
Scalp? Okay. And did you do this autopsy in Murfreesboro?
I did not. I did this autopsy at the Regional Forensic Center in Nashville.
All right. And I think you testified that, and this is on page 4 of your original autopsy report, under the cause of death, you found it to be the stab wound to the chest. Is that right?
That would be on, according to my numbers, page 6 of 6 of the autopsy report.
Yeah, and some of mine's including a certificate of death in it, and I don't know if yours has that or not, but where it's headed autopsy report, in the center of the page with a line under it.
Yes, that would be page 2, also on my report.
Okay. And it says a maximum depth of 2 inches. Is that right?
That's correct.
Now, you testified a moment ago that there is a difference in a stab and a cut. You said cut's more layman's terms. I think you called it an incised wound.
That's correct, yes.
Okay. So is cut another word for an incised wound? I believe that's what you said.
It can be. Again, sometimes the terms are used interchangeably, but technically an incised wound is from something with a sharp edge.
And would it also be true that a stab is where the depth is greater than the width?
Actually, usually the stab wound is described as when the depth is more than the length, but not always. In this particular case, there are some very superficial wounds that I've described as stab wounds, but it doesn't necessarily follow that rule.
Right, and that's what you told the DA a minute ago, or I thought you did, that the difference in a stab and a cut all has to do with whether the length is, if the depth is greater than the length, that's a stab. But if the length is greater than the depth, it's a cut.
Or an incised wound is the technical term. And again, those are generalities. They don't always follow that pattern. But in any event, those are both descriptions from something that's caused with a sharp edge on it.
Right, but that's what you told the district attorney a minute ago, correct?
Well, I told that to the jury, yes, sir.
Okay. Did you examine the knives in this case?
I did not.
Are you aware of the length of the knife in this case?
I have been told that it is approximately 4 inches, I believe.
Okay. Now, on the addendum report, you say that it's 5.5 inches below the top of the head. Is that right?
Yes,
And it's 1/4 by 1/16?
correct.
Now, is the 1/4 the length?
Yes.
So and would there be bone under that?
Yes, the bone lies very close beneath the skin and muscle at that area of the body, yes.
And was the bone chipped?
No.
And are you saying that with respect to the hairline, that the length was greater than the depth?
That's what I'm saying in this case, yes.
Okay. And as to the back of the left shoulder, the wound on the back of the left shoulder that you described the dimensions, I believe, as 1/4 by 1/8. Is that correct?
Yes, sir.
And the 1/4 is the length, correct?
Yes.
And the 1/8 is the depth.
No, the 1/8 is the width.
The width.
Yes.
So the quarter is the depth?
No, the quarter is the length, and then 1/8 is the width.
So there is no depth on that one at all?
It was so superficial, it was almost difficult to measure how deep it was.
Okay. And as to the wound on the left upper arm, what was the dimensions on that?
1/2 inch.
By,
That's what, I only gave one dimension on that. It was
Okay.
1/2 inch.
because there was no depth?
Yeah, it was so superficial. Again, the depth would have been impossible to measure.
Okay. Now, on your autopsy report, and you kind of covered this a minute ago with the DA, but just so I understand, with respect to the stab wound to the chest, it says it was 1.5 inches right of center. Is that right?
That's correct.
And it entered into the right first intercostal space.
Intercostal space?
Okay. And the intercostal space is the space between your ribs, correct?
Yes.
And that's also known as ICS. Would that be true?
That would be an abbreviation for it, yes.
Okay. And your intercostal space is numbered. In this case, it was the first intercostal space, correct?
Correct.
And it's numbered for the rib just superior to that particular space. Is that
That's
right?
Yes, sir, that's correct.
So 12 ribs, 11 intercostal spaces.
Yes.
And the knife cut the root of the aorta and the right upper lung, I believe is what you testified.
That's correct, yes.
No evidence that the knife struck any kind of a bone.
No.
Now, the aorta is the largest artery in the body, is that right?
Yes, that's correct.
And the purpose of the aorta is to distribute oxygenated blood to all parts of the body through our system. Is that right?
Yes, and it also helps maintain blood pressure as well.
Mm-hmm. And the aorta is critical.
Yes, it is critical.
And just so that we can understand exactly what we're talking about with respect to how critical, the body has two main kinds of blood vessels, arteries and veins. Would that be true?
Yes.
Arteries transport oxygenated blood from the heart and lungs to the body and its organs. Is that right?
Yes.
And then veins transport that blood back so that it can be reoxygenated and go back out. Is that right?
Yes.
And you mentioned that there's pressure there. The truth is that the blood pressure is highest in the aorta area, isn't it?
Yes.
And would you agree that an injury which hits the aorta would incapacitate someone almost immediately?
No, that's not entirely correct. Someone who has their aorta, in this case cut, would not be immediately incapacitated. The only way you can immediately incapacitate someone is by an injury to the brain or the upper cervical spinal cord. So she would still be able to potentially move or walk, run in some way. So no, it's not immediately incapacitating.
Okay. Well, it's not going to be very long, is it?
No, it would not take very long.
Now, the aorta is not anchored in your body, is it?
I don't think I understand what you mean by anchored.
Well, does if I go like this, does the aorta rest against the backbone in a normal anatomical position?
It does, yes.
And if I go like this, does my aorta come to the front?
No, it does not.
It doesn't swing at all?
Not unless you have some type of abnormality, no.
Okay. So it is anchored against your backbone?
Yes, I will use the term anchor. It's not really a medical term that I would use, but in normal movement, your aorta doesn't move into different parts of your body, no.
It doesn't move at all?
There's maybe a little bit of slight movement, but certainly it's minimal.
Okay. And with respect to the downward motion, that you said the knife, I'm talking about the stab wound to the chest, was in the 1 to 7 o'clock position, and it was downward, correct?
Yes,
And that's taken the body in the normal anatomical position, correct?
correct.
And the normal anatomical position is what?
The normal anatomical position is when the deceased person is lying on their back with their arms down by their side, palms up.
Now, you've never seen anybody fight in that particular position, have you?
No, sir, I have not.
And furthermore, rarely, if you can't, like what I'm standing here with my hands on the podium, I'm not in the normal anatomical position, am I?
No, sir.
And neither are you sitting there testifying, correct?
Correct.
So if someone was bent down and they was in the process of a fight and the knife was stuck in, and then you take it back to the normal anatomical position, it would appear to be a wound that was inserted in the 1 to 7 and downward, correct?
That's correct. The downward is in reference to the deceased person in the anatomic position.
Can I have just a moment, Judge?
Sure.
Dr. McMaster, you've been through a lot of schooling like you told us in the front, correct?
Yes, I've had several years of education.
And testified a lot in court, always been declared an expert, is that right?
Yes, I've never been not allowed to testify as an expert in forensic pathology.
Right. Now, would you agree with me that the human brain the development of the brain is from the back to the front?
I have to be frank, I don't remember in what direction the brain develops, whether it's forward to back or back to front.
Whichever way it is, would you agree that the brain develops from either back to front or front to back?
Again, it's been many, many years since I've had developmental embryology or anatomy, and I would not feel comfortable testifying about the development of the human brain.
Okay, well, let me ask you this. Would you agree with me that the brain does not fully develop until someone reaches approximately 25?
That I'm not sure about either.
Thank you, Dr. McMaster.
You're welcome.
Well, whether their brains developed or not, they know when they're killing somebody, don't they? Take a knife and stab them several times.
I'm sorry, I don't know how to answer
Well,
that.
he indicated that somebody who might not be yet 25 may have problems knowing they're killing somebody. That's not normal, is it?
Again, I would consider that outside of my area of expertise.
Okay. And as far as a person's age, how old do you have to be to kill somebody?
Again, this is outside of my area of expertise, I believe.
Okay. Well, let me ask you this. Have you ever heard of teenagers killing people?
Yes, sir, I have.
Have you ever heard of 12, 13, 14-year-olds killing people?
Unfortunately, yes, I have heard of that.
Now I want you to look over at Miss Madden. Is there anything about her that you can observe that would tell you she's not capable of killing somebody?
Just at a initial glance, no, sir, I don't know.
And if there was some mental problem, you've testified in several murder cases before, haven't you?
I have.
And the defense could certainly get an expert and bring in the fact that she had some mental problem, couldn't they?
They could, but again, that's something that I do not testify about.
Just please answer my question, could they?
Yes, sir.
And if they've got it, they'll put it on, won't they?
Yes, sir.
Now, as far as stab wounds and cut wounds, you mentioned in your report how many stab wounds, if you count them, as far as stab wounds, superficial wounds, whatever you want to call them, how many stab wounds do we have?
4.
Thank you.
Other questions, Mr. Brown?
No, sir.
Any questions from our jurors? Not seeing any, thank you, ma'am, you step down.
Yes, Your Honor.
Step
Thank you.
forward, free to go.